Hi everyone, today I want to discuss about the USG artifact. Let's start basic concepts. One, ultrasound artifacts are image features that do not represent real anatomy. Artifacts occur due to interaction of ultrasound beam with tissues. Most artifacts arise from incorrect assumptions of ultrasound machines. Ultrasound assumes sound travel in straight lines. The machine assumes constant speed of sound 1540 millimeter per second. Ultrasound assumes echo returns from the main beam only. Violation of these assumptions causes artifact. Some artifacts are helpful diagnostically, others may mislead diagnosis. Artifacts depends on tissue density differences. First artifact is reverberation artifact. Reverberation occurs when sound bounces between two strong reflectors. Reverberation produces multiple equally spaced echoes. It is commonly seen near air-tissue interfaces. Reverberation artifacts appears as parallel lines. It commonly occurs in lung ultrasound. Gas in bowel commonly causes reverberation artifact. Metal objects produce strong reverberations. Reverberation decreases in intensity with depth. Needle visualization often shows reverberation lines. Reverberation is responsible for A lines in lung USG. Next artifact, comet tail artifact. Comet tail artifact is a type of reverberation artifact. It occurs between closely spaced reflective surfaces. It appears as a tapering bright tail. Comet tail is commonly seen with cholesterol crystals. Gallbladder adenomyomatosis shows comet tail artifact. Comet tail artifact indicates high reflective interfaces. It is a short path reverberation artifact. The artifact narrows as depth increases. It often appears as triangular bright streak. Comet tail artifact is a useful diagnostic sign. Ring down artifact. Ring down artifact occurs due to resonance of gas bubbles. It produces continuous bright streak. Ring down differs from comet tail by long continuous echoes. It is commonly seen in bowel gas. Lung ultrasound B lines are a type of ring down artifact. Ring down occurs when gas bubbles vibrate continuously. It extends deeper than comet tail artifact. Appears as bright vertical line from reflector. Common in pneumobilia and bowel gas. Indicates presence of gas collection. Next artifact, acoustic shadowing. Acoustic shadowing occurs when sound is strongly attenuated. It results in dark shadow behind structure, common behind stones. This artifact is very common behind stone. Gallstones produce clean acoustic shadowing. Bones also cause acoustic shadowing. Calcification creates posterior shadow. Shadowing helps to detect renal stones. Metallic objects produce strong shadowing. Shadowing indicates high acoustic impedance. Gallbladder stones are diagnosed by shadowing. Acoustic enhancement. Acoustic enhancement occurs behind fluid structures. It causes increased brightness posteriorly, also called posterior acoustic enhancement, seen behind cyst. Urinary bladder shows enhancement artifact. Enhancement helps differentiate cyst versus solid mass. Sound attenuates less through fluid. More sound reaches deeper tissue. The result is brighter echoes behind the fluid, common in simple hepatic cyst. Next artifact, mirror image artifact. Mirror image artifact occurs near strong reflectors like diaphragm. It creates a duplicate structure on opposite side. Liver lesions may appear mirrored in thorax. Occurs due to multiple reflection pathways. The machine assumes straight return path. Mirror artifact appears deeper than true structure, often seen in liver diaphragm interface, also seen near bladder wall, appears as symmetrical duplication, recognized by identical appearance of structures. Next artifact, refraction artifact. Refraction artifacts occurs when sound changes direction. It happens when beam crosses tissues with different speeds. Refraction can create duplicate images, also called edge artifact, seen at edges of curved structures, causes shadow-like artifact at margin, common around gallbladder edges, occurs due to Snell's law of diffraction, can cause lateral displacement of structures, appears as dark edge shadows. Next artifact, side lobe artifact. The side lobes are weak beams outside main beam. Side lobe echoes may be misplaced in image. Occurs near strong reflector, most common in fluid field structure, can create false internal echoes in cyst. Appears as debris inside cyst, caused by energy emitted off axis, reduced with modern transducer design. Harmonic imaging reduces side lobe artifact, often mistaken for pathology. Beam wide artifact. Beam wide artifact occurs due to finite beam thickness. Echoes from outside imaging plane appears in image, seen as false echoes in cyst, common near edges of structure, occurs when beam covers multiple tissues, result in volume averaging, more common with side beams, reduced by focusing transducers. Narrow beam improves resolution, appears as internal echoes in anechoic structures. Next artifact, speed error artifact, occurs when sound speed differs from 1540 meter per second assumption. Structures may appear deeper or shallower. Fat tissue often causes speed error, causes distortion of structures, appears as misplaced anatomy, occurs in heterogeneous tissues, rarely clinically significant, more visible in large fat layer. Machine miscalculates distance, leads to depth misregistration. Range ambiguity artifact occurs when echoes return after next pulse. Machine places echo too close to transducer, seen in deep structure, occurs in pulse ultrasound system. More common with high PRF. Causes duplicate structures, appears at incorrect depth, occurs due to timing confusion, reduced by lower PRF, mostly seen in Doppler imaging. Next, Doppler artifact. Aliasing occurs when Doppler shift exit Nyquistic limit. Aliasing occurs when Doppler shift exits Nyquistic limit. Appears as color reversal in Doppler imaging. Aliasing occurs in high velocity blood flow. Increased PRF reduces aliasing. Baseline shift reduces Doppler aliasing. Flash artifact occurs due to patient motion. Blooming artifact causes color spill beyond the vessel. Spectral broadening occurs due to turbulent flow. Mirror artifact may also occur in Doppler imaging. Color noise may appear in low flow states. Miscellaneous artifacts. Slice thickness artifact is similar to beam width artifact. Propagation artifact occurs due to beam distortion. Multipath artifact occurs when sound takes multiple routes. Clutter artifact appears as low-level echoes. Twinkling artifact occurs in colored Doppler line stones. Twinkling artifact helps detect renal stones. Speckle artifact is grainy noise in ultrasound. Harmonic imaging reduces many artifacts. Spatial compounding reduces speckle noise. Proper probe positioning reduces artifacts. Exam related important points. Posterior enhancement indicates fluid field lesion. Acoustic shadow suggests tone or calcification. Mirror artifact often occurs near diaphragm. Reverbation is common in air interfaces. Ring down indicates gas bubbles. Comet tail occurs due to short reverbation. Edge shadowing occurs due to refraction. Side lobe artifact create false echoes. Beam white artifact occurs volume averaging. Understanding artifact improves diagnostic accuracy in ultrasound. Thanks for watching.